Please note that the public section of the meeting will be recorded and published online for public access after the meeting. Can all attendees please mute their microphone when not speaking? We have apologies today from Fraser Bell and Claire Wilson. Thank you, Chair.
Great. Thank you very much. I have a request for an adjustment to the agenda. Could we agree, this is item 7.1, the CAMS report. Could we agree to take item 7.1, the CAMS report, just after the business planner? That will enable the relevant people to depart earlier. Is that okay? Great.
Yep, agreed.
Okay, thank you. So do any members have any declarations of interest or transparency statements they wish to make? Anything? Nope. Good. There is no exempt business. 3.1, the minute of our previous meeting, the 2nd of May, that's been circulated and is before us for our approval. Any problems with the accuracy of that minute? Nope, that's approved. Lovely. Then the business planner at 3.2. Does anyone have any questions on the business planner? Luann.
Hi, morning, Martin. Sorry for joining late, but there seems to be IT issues this morning, so I'm on my phone. It was just a note in the minute, page 3, it describes Anne McKenzie being present. And I had a bit of a thought. I wondered if our retired commissioner was back, but I think it was maybe meant to say Anne MacDonald, who was our Audit Scotland colleague on the call. So it was just a minor error to note.
Okay, well spotted. Thank you. That's great. Thanks. Otherwise, the minute is agreed. It's now approved. The business planner. Anyone got any questions on the business planner? Item 3.2. I would. Can I just chip in on item 12? There's the Navigator project. We're going to get a service update. Could I just ask when we're going to get the service update on the Navigator project? Is that coming up soon? Who might be able to help with that question?
I'll come in here.
Right, who's that? Simon, is it? Yeah, okay, Simon.
So the Navigator project, although it was agreed at the IJB a while ago, actually only went live in August 2022. So we won't have full year data and full year information until sort of September, October this year. So happy to come with a full report at that point. I don't know when, if you have a meeting in October, that would be ideal.
Right, so you're suggesting a full report rather than a service update?
Well, I'm happy to do whatever anybody needs or wants, but I've got information as a service update that is 6 months worth of data, but it's not a very rounded report. But happy to do a 12-month service update in October.
Okay, it would just be, I think it would be useful to have that service update at some appropriate time. I mean, at some point before the full report, if possible. But I think that would be welcomed by everyone if that's possible to have that service update once it's ready, without adding too much pressure. It would be, I mean, it's an issue that's important to us, so that would be appreciated.
Okay, thank you.
Thanks very much. Anything else on the business planner? Nope, I think it's all very straightforward. Luann?
Thank you. It was just a query. Our colleagues from Justice Social Work, there's a deferral on their report. It was just to understand like what was behind that, and that just wanting to make sure everything's all right within that important area of work.
Yeah. Paul?
Yeah, I can update Luann here. It's purely just through work pressures that they've been unable to complete the report in time for this committee cycle, so it will be into the next cycle. But there's nothing wrong with the, you know, with the performance report, and just purely through work pressures.
Okay, thanks for that. Thank you for that information. So we are noting the business planner. Great, thank you. So that takes us to item 7.1. We've agreed to take the CAMS report 7.1 at this point. Amanda, is it Amanda and Judith here? Yes.
Hi, Jude, it's Judith. I'm here
Yeah.
today for
Yeah.
Amanda. Amanda's on the
Yeah.
call today. So people maybe don't know everyone on the call. I'm Judith McLennan. I'm new lead for mental health and learning disability services. That's the hosted services that include inpatient specialist services and CAMS. So I think Amanda did plan to come along today because I think she spoke to this report previously, but like I say, she's on call, so I said I'd come along today anyway, as I haven't been to this committee previously. So this was an update on the Mental Welfare Commission report, the Young People Monitoring Report 21-22, that had a number of recommendations included, and committee were seeking an update and assurance as to where the CAMS position was at the current time. Amanda's prepared the report and she's copied in the kind of full appendices of the Young People report from the Mental Welfare Commission and in the NHS for Scotland National CAMS Service Specification Standards that they're working to. So the purpose report is just to provide that update, and I think Amanda and the team wanted to highlight that there actually has been a decrease in a number of our CAMS admissions to the Young People's Unit in Dudhope and to General Adult Mental Health Services over the past year. So we're actually seeing a reduced figure where I think a number of other boards within the data set would report a slight increase on figures. So a better position for Grampian down to from the previous year. So Amanda has included a summary of the various recommendations and highlights and provides that reassurance to the committee. I don't know if you want me to go into any further detail on that or open up for questions on our report.
Well, maybe we could open it up to questions. Could I start off by asking, there's a noticeably lower proportion of young people in the northeast, in Aberdeen and the northeast, being admitted to CAMS services. Is there a reason for that?
So the CAMS service would state it's in recognition of the development they put in their outpatient community services and their multidisciplinary team working. So it's the variation of services that they've moved towards. They've also integrated more with the adult unscheduled care teams and liaison psychiatry teams, and ensuring that there is robust support to young people out of hours. There's also the consultant on call model 7 days a week, which has access to that unscheduled care and out of hours services where young people present. So the patients, when they're seen out of hours, can then be followed up very quickly at planned deferred appointments through the week as well. So they would see they put in a greater resilience into that out of hours and unscheduled support.
Okay, that sounds very positive. So basically, there is less requirement for Tier 4 referrals in Aberdeen and Grampian. Would that be the case, i.e. for inpatient care?
Yes, so there might still be the requirement for a patient to be seen as an emergency and in an unscheduled manner, but they'll be able to be seen with a view to signposting to planned deferred appointments and being seen by trained professionals out of hours rather than admitted as a kind of smaller option for the patient and their family.
Okay. Thank you very much. June.
Thank you, and thanks, Judith, for that explanation. I suppose the bit that I want to pick up, and I'm quite aware that there have been some challenges from a workforce perspective in that out of hours time. Has that been resolved in relation to psychiatry cover?
So the psychiatry cover, to my understanding, is that there's still psychiatry cover through the daytime hours, and in nighttime hours it would come from the unscheduled care team, and they would link into the daytime consultant with that deferred appointments, or there is 7-day out of hours contact, 9 to 5, Saturday, Sunday, so to be able to contact them.
So just for clarification then, adult psychiatrists would be seeing children in that space?
Other psychiatrists or specialist nurse practitioners would be seeing the patients then.
Yeah, great, thank you.
Okay, thank you. Luann?
Thank you, and thanks, Judith. A couple of questions from me. I note in the recommendation from the Mental Welfare Commission, there's a specific ask about provision of weekend activities and in the evenings as well for this group of young people. And I just wondered what we've done in Grampian to make sure that that support is really robust around evenings and weekends. And then I've got a second question as well.
Okay, it's my understanding, Luann, and I'm still learning that kind of level of detail, but my understanding at the moment, and I could always provide a confirmation kind of follow up to that, is that there is therapeutic activity offered by our occupational therapy department within the main adult service, who link in with the CALM service to provide that training education. So there is, it's almost like a activities assessment when the patient's first admitted. But they're here for such a short period of time because if the admission is needed to go on, they move on to Dundee to the Dudhope unit. So it might be they're only here actually less than 24 hours. So it's very unusual for patients to stay here for longer.
Okay. So yeah, I suppose it's just that assurance that we're acting on that recommendation, but I understand if they're only there 24 hours or less, then that's not relevant, but good to just get that confirmed. And then my second question is, I suppose, what's our intent around this? Is it to have zero transfers like this, or are we having to accept, because of the situation and the facilities available, that we'll always have a small number? So just to get clarity on what the intent is, and is this something that we need to keep monitoring as part of the Mental Welfare Commission actions?
Yeah, sure. My understanding to date is I don't think there'd be an expectation there'd be zero admissions to a specialist child and adolescent unit, but those admissions would stay as local as possible. So Dundee is obviously our regional unit, and as far as possible and as quick a time possible that if a young person needed admitted, they'd be transferred to that specialist unit. However, in recognition that there is alternatives to inpatient treatment, then the team are working through a workforce plan and a service model to look at what crisis services might look like in Grampian. And that might be looking to join up with all the ages crisis teams as well, in recognition that might actually just be one referral a month. So the viability of having a specialist CAMS crisis service might need to look at kind of training, supervision and support to develop other adult teams so that they've got capacity to deliver and move to where the need is. I don't know if I said that very eloquently.
So what I'm taking, Judith, from what you're saying is there's work ongoing to look at what's the best provision to meet local need. I wasn't meaning that there wouldn't be any young people needing residential, but is our intention to not have any inappropriate transfers into adult settings? That's what I meant. I guess there will always be, for some young people, a need for residential care.
Yeah, I think with regards to Mental Welfare Commission and the CALM standards, it would be an expectation that children always and young people are always admitted to that specialist unit.
Yeah. Okay. Okay, thanks. And is it something we need to keep our sights on here, or what do we do next, I suppose, with this?
I'm aware that there is challenges with the resource release for CAMS. I think it was significantly short than was originally anticipated. So there's yet to be some confirmation about funding coming through from the Scottish Government in the continued development of the CAMS service to take in services like crisis, home treatment support. So I don't think it's quite resolved yet.
Martin, can I come in? I would just echo
Yes.
Luann's ask in relation to keeping this on the agenda, just for the reasons that Judith has described, and the lack of funding in relation to CAMS. And there'll be a need for the services to make a prioritisation of how that money's spent, and it'd be good just to keep an eye on that. Thank you.
Okay, thanks for that. I mean, I would tend to agree. The mental wealth, the the Mental Welfare Commission report is really useful, really interesting. It is quite a strategic document. It's nationwide, but it seems to make some really valid points about unmet need, and it's not always clear how the report relates to Aberdeen and to the Northeast area. For example, there's mention of the need for young people's advocacy. I don't know if that's, I don't know if we're needing to do more there. There's mention of the need to identify educational needs amongst young people. Again, it's quite strategic. There is mention that there's a very low level of discussion with young people about their educational needs, and also that there's inadequate provision of social work. There's mention of there are fewer admissions for those with learning disabilities, but they are of a higher percentage. So there's a variety of quite general statements that it might be useful to know how these relate locally. I don't know if that's possible to do, because that's quite a lot of information being requested there. Luann.
Yeah, Martin, just to say that this is an update report on work from the Welfare Commission some time ago. So I recall we did have a fuller report previously that covered what we're doing locally around advocacy and some of those wider questions. So maybe the ask could be that when an update comes back, that we just go right back to the full Mental Welfare Commission report and see if there's any changes that need to be highlighted. But we have considered a detailed report on those topics in the past.
Right. Okay. Yeah, that would be useful to see. Okay. Okay, thanks for that. Any other questions on 7.1 CAMS? Okay. That's great. Thanks very much, everyone. Thanks for the questions. And we can agree the recommendations there. Great. Let's go back to Luann.
Apologies, Martin, just for Judith's benefit. So we're asking for an update report, but we'll discuss offline when that would be.
Yeah.
So Judith, you can come back to us with what's going to, we don't want to be asking people to write reports for the sake of it, but this feels like a number of risks around this. So probably maybe 6 months to a year away, but that we get it on the planner. Does that seem reasonable?
Yeah.
That would be good to help us to track what's happening there. That would be good. Okay, thank you very much. We can go back to the original order of the agenda. 4.1 is the review of financial governance. Paul Mitchell has produced this.
Yeah, this is the annual review of the to ensure in compliance with the financial governance of the financial statement and the role of the Chief Finance Officer through the SIPA guidance. Yeah. So what I've done is I've updated the Appendix A with the relevant dates, and it's just the annual review. It has to be noted.
Anybody got questions on 4.1? Luann.
I think I've got questions on everything today. Apologies.
Good. That's good.
Paul, I suppose I was thinking about, so finance is our enabler to drive the transformation we want to see. And I'm thinking of you as a new Chief Finance Officer coming in, and I'm just wanting assurance that you're also getting support to kind of go out and understand the service models we have, how the importance of prevention, early intervention, and tackling health inequalities, so that we're getting that longer term commitment to what will be a more financially sustainable model, rather than when I was reading that, it's all, we need to do all those things that are listed, absolutely, but I think it's also really important that our Chief Finance Officer has a really good grounding in what's going to make our services financially sustainable. So it was just to get a sense of, are you getting that insight into the system as well?
Yeah, I am, and I get you know, I get taken around all the different various establishments and stuff like that. The one I haven't been around is the Cornhill, because my the arrangement was meant to be when it was running about when Jane was leaving and Judith was taking over, but I haven't rearranged that one. But that's on the plan to kind of go up and have a visit around that hospital. But the other ones, all the senior managers are taking me through their bits, telling me their woes. And I am getting visited, you know, like a Sandy takes me around the vaccination centre and tells me all his woes as well, been around the health village, etc. So I am kind of ticking them off as we go.
Good, thank you.
Thanks. Could I ask about the budget protocol that's mentioned on page 17? So is that a procedure that would involve consultation with partners, with care providers and so forth, to help us with financial planning? I mean, maybe an opportunity for dialogue and to discuss cost pressures and so forth.
Yeah. During the budget process, we go through the you know, where are the pressures coming from with the providers, etc. I also have meetings with Aberdeen City on the funding that's coming from them. I've had meetings with the NHS as well about the funding that's coming from their side. And during the budget setting, I also have meetings with the other two CFOs from Murray and the Shire to make sure that we're all lining up on a Grampian perspective. So our assumptions are now wildly at odds with each other. So all that's part of the budget setting process.
Good. Okay, that will, yeah, that will help with transparency amongst the partners. That's great. Could I also ask another question on page 24, which is about, where is it? There is mention of developing financial skills, and I mean, I wondered, does that include committee members? Sort of training updates and so forth for committee members. Is that intended?
Yes, it is. I did notice it was done in the past, a way back, and it is on my I had my objective meeting last Wednesday with Fraser and Sandra, so that's on the list of things to kind of tick off for this year for training off for senior managers and for committee members. So in case I watch this space.
Yeah. Okay. Well, I'm pleased to hear that personally. Thank you. Thanks for that. Okay, that's great. Any other questions? It's a very comprehensive document. Shows we've got a whole systems approach with financial planning. It's all very reassuring. So we're okay with that? Okay to note that report? Yes, good. That's great. Thank you very much. We can therefore move on to 4.2, which is the financial monitoring update. Staying with Paul.
Yeah, this is the update for Q4, and apologies, this should have been at the last committee to tie in with the accounts, but due to my absence, we missed that deadline. So this really takes the accounts and breaks it down into just the normal quarterly monitoring we get. And you'll see from this that there was a £24 million overspend on the comprehensive income and expenditure statement, which goes into accounts, but that's before all the transfers to and from reserves. So once we do the transfer to and from reserves, we're actually a small surplus of £1.1 million for the year, and that has then been carried forward into integration and change reserves to be used going forward. So if there's any other questions, I'll try and answer them.
Okay, thank you. There's some significant fluctuations at this time of the year. But anybody got questions? Luann.
Thank you. A few questions from me. One just interesting to see the primary care underspend at Q4. So just to understand what caused that and what are we doing to address that, because clearly there's huge challenges within our primary care system, so it kind of seems at odds that there would be an underspend. So that's my first question. And then secondly, we've got more funds going into our change fund, so it's just to understand when and how IJB members will see that coming through, the ideas for spend of the change fund. Thank you.
The primary care underspend is mainly due to the rates rebate that we got last year. So that was a one-off. There was a rates rebate and there was a water rebate as well. Now that I think so, there was millions coming back in for the rate, so it's not expected to recur in next year. The water rebate, there was a certain element of recurring under recovery there, so we took it in as part of the savings as a budget setting. So we're not expecting the same fluctuations, obviously, next year in there. And as far as the change fund, whenever there's a project gets earmarked to come out of the change fund, it goes through the process, like through the SLT and then up, and then there'll be a report goes to the IJB saying, is it okay to use the change fund money to fund this? So there's been a few last year, but there's nothing sort of earmarked to come through just yet. But what happens is I keep a running tally of what the change fund is, and then whenever there's a report comes to the IJB, if it's over 2 years, 3 years, etc., I account for that over the 3 years. So we've got a change fund balance of about 17 million, but it's unallocated. It's only about 6 million, I think, from memory.
Thanks, Paul. Yeah, so just on the change fund then, so it's not that I just wondered if maybe the reason we weren't seeing things come through was because it was small amounts of funding that were being allocated, but I think what I'm hearing is it's more that the team rightly are taking time to develop up what's needed for longer term. Is that a fair understanding?
Yeah, we've got to make sure there's value for money, and also that all these things that are paid out of the change fund have got an exit strategy. We can't do it if it's recurring, so it has to be over a finite period, 2, 3 years, etc. like that. So by the time it actually comes into coming out of the pot, it's, we've done all those checks and balances just to make sure it's not ongoing. Because we don't want to start funding things that are ongoing. The pot runs out, and then we're left with budget pressures down the line.
Okay, thank you. Thank you for that. Could I ask about the item on primary care prescribing, which is 9.4% over £3.684 million. Is that a kind of expected position to be at this time of year? I mean, I'm noting the increase in prices and the challenges of supply and demand, but is that a fairly regular fluctuation?
We've been forecasting an overspend in this line the whole year, and unfortunately there was big pressures on this at the budget setting time as well. So we sat with the prescribing team, and again with Murray and Shire we worked out our budgets going forward. So there was quite a significant increase in the budget for next year. I think it was about £6 million we added on to the prescribing budget to try and alleviate the pressures. But there is a group going to be set up between Alex and the 3 CFOs and the prescribing team to see what we can do to kind of rein this in and make sure that we're obviously, if they're getting extra budget this year, we can't be in the same overspend position next year.
Yeah, okay, that's fine. Thank you. And could I also ask about there's another quite major variation, which is for directorate, 455k under, which appears very significant. I wondered what the reasons are for that underspend there.
That was just an underspend on the staffing complement, staff savings there, just in time in between the recruitment, people leaving, people coming on. It's purely on staffing.
Okay. Okay, thank you. Any other questions on the finance monitoring? I think it's quite. It's quite reassuring to see the under budget of 1.126 million. So prudent management of the funds. That's good to see. No other questions. In that case, can we agree the recommendations? Okay. Thank you. Review of 4.3, review of duties and year-end report. Our annual review. So Alison and Paul are leading on this.
I'm happy to present, if
Yes.
that's okay.
Okay, thank you.
Okay, thank you. So the purpose of this report is to provide an overview of the Risk Audit and Performance Committee's business in relation to its terms of reference. And the appendix lays out the duties as per the terms of reference and notes the meetings and the details of the reports that were considered in relation to each of these duties in the financial year 2022-23. The appendix also details the forward planning for this business for the current financial year. It should be noted, however, that the forward planner was populated from the business planner as it was in April. So things have changed already, as we know, and indeed further business will be added as the year progresses. So we do bring this report annually. So the report that comes in May, June next year will provide full detail of the business for 2023-24. So I'm happy to take any questions.
Thank you very much. It's very useful to have. Well, I think this is very well structured. It's a very useful, reflective tool. It's good to have a mirror to understand how the committee is doing. Could I ask about the transformation program, which is at page 48. So it's page 48. Yeah. So in terms of our monitoring, the committee's monitoring of the transformation program, should we be reassured that that we have that we have some gaps in our activity there? Still ongoing, obviously.
So item line 6, I'm assuming you're referring
Yes,
to on page 48. Yes.
Yes, 48.6.
So that one's about the transformation and service quality initiatives. It's not just about the year 2 delivery plan, which is the bulk of our transformation activity. So absolutely, last year we received a couple of specific reports in terms of primary care improvement and adult support and protection. But as you rightly say, in terms of year 2 delivery plan and the rest of the transformation projects, the committee receives a quarterly performance report, and these are noted under the performance section. So it's just, sometimes there is more than one place that we could allocate a report to. So hopefully between the two, between the quarterly performance reports and the specific reports that you occasionally receive out with that, I hope that gives the committee assurance overall.
Okay. Thanks for that. Something for us to think about. June.
Thanks, Martin. Alison, so I'm not sure I'm going to frame this question well, but I'm going to give it a try. So I'm trying to think about care and clinical governance in this space of, the Risk and Audit and Performance Committee. And I'm trying to understand the relationship between your clinical and care group and this group and how they work interjectively. So things like adult support and protection inspection report, I would expect that to be in clinical and care governance, not here. So I'm just trying to unpick that. And is there something that committee should be reporting into RAPC? I'm not sure. So thank you.
Mm-hmm.
Thanks, June. Yeah, the Clinical and Care Governance Group obviously report to the Clinical and Care Governance Committee. And indeed there are overlaps. We've had many discussions. In fact, I think that particular report that you mentioned in terms of the adult support and protection, I think it went everywhere. It went to IGB, it went to Clinical and Care Governance, and it came to RAPC. And we've had many conversations over the years in terms of whether is that okay. Should one committee just get a report, but then the terms of reference are different. So clinical and care governance would be looking at the adult support and protection report in terms of their lens, in terms of obviously is the care and the quality of care there, whereas Risk Audit and Performance Committee are more interested in that report from risk and performance point of view. So you will find that a lot of these reports will go to more than one committee, and it's just making sure that each of the committees are looking at it with their own particular remit in mind.
Thanks, Alison. I think in an NHS board, you've got the same dilemma. You know, you would be looking at things with different lenses. So from that clinic, you know, so clinical and care will have risk as well as part of it. So I suppose my question is, does this group look at risk in its entirety, or is it just looking at risk in the context of finance and performance?
It's mainly in the context of finance and performance, but obviously the strategic risk register comes to this committee as well. So that then leads us into other areas as well. So it's very difficult to contain each report. You know, there is crossover.
Thank you.
Okay, thanks for that. Luann?
Yeah, on a different point on page 52, there's the section where this committee work is to act as a focus for value for money. And there's nothing in that. So I wondered why that is and what's the plan for addressing that.
Yeah, I think I'll take this one. We kind of query this one ourselves, because the monitoring comes through. We could take that as value for money. The procurement plan comes through. You know, we're reviewing all these plans and the procurement, and it's a bit like Alison says. You know, there's several reports could tick several boxes on here. So the fact that we're monitoring, we're underspending, does that automatically mean there's value for money? So I wasn't sure if there was going to be a specific report requested and how we would actually prove it or show that.
Paul, if I can come back, I wonder, I'm just wondering why it was a separate title and whether at some point in the past there was meant to be value for money audits going to be done for IJBs, but I understand that's not the case because of the National Care Service coming on. So I wonder, do we need it as a separate heading? Because if it's a separate heading, we should have things against it, I think. Or do we look at just incorporate it into our business as usual and we report it as you've described? I don't know if anyone on the call will know why that was put in specifically, and was it to do with the plan for that value for money auditing coming through?
Yeah, I could maybe just come in there. So obviously these categories come from the terms of reference for the committee. So that's why, so that is mentioned in our terms of reference. So that's why that category is there. But absolutely, you know, I mean, I was maybe a little bit literal in terms of allocating a report to a category, but or to one of the duties. But you know, I think maybe for next year we can maybe consider that a bit rounder, and maybe put reports in multiple categories, because I think the report overall does give assurance that the committee is doing what it should be doing in terms of its terms of reference.
Okay.
So,
yeah.
So just to pick that up, so does that mean that that value for money slot will remain, and does that mean that there will be action to identify efficiencies, minimize waste, support transformation, that kind of thing? Will there be more information to fill in on that kind of detail?
So a lot of the reports that you receive already will cover those kind of areas. Yeah. So yep, so when we're reviewing it for next year and reporting next year, I think what you'll see is the same report perhaps being noted under several of the categories. so that we can actually track that through. So if one report covers value for money and transformation and performance, it will appear in each of those categories rather than just one.
Thank you. Sorry, I think I interrupted you, Luann. Sorry. No, okay.
No, but I think it was more like it's just what Alison said there. It's maybe more just using that language in the reports we're getting so that we're clear that here's the value for money bit. This is how we're doing that through this report, and that'll help us just see it more visibly. But yeah, it should be in everything that we're thinking of. Thanks.
Yep, totally. I wondered if there was space within here for reference to community planning and to the LOIP. I mean that does relate, for example, to performance in achieving objectives and so forth. Also value for money. Is that an area where we should be focusing a little more on? I mean that's where we really do our best to tackle health inequalities. And that is about financial stability and about finding sustainable financial solutions. But it's I don't know if that's adding kind of peripheral information in or not.
So the premise for this report was to match against the terms of reference. So obviously the whole community planning is not in our terms of reference. So you know, we can consider whether it needs to be in there. But of course, the community planning has a whole reporting aspect of its own. And you know, I don't know that we would want to duplicate that effort. I don't know, maybe there's something that we do in terms of bringing some of these community planning reports into this committee so that you could have that scrutiny. But it would be copies of reports that are already going through the community planning process.
Yeah, I mean, I was thinking more in terms of cross-referencing rather than duplicating. You know, just kind of affirming that this, you know, we're tackling risks which are related to achieving the LOIP outcomes, rather than adding excessive unnecessary detail. It's because just a thought that we might be wanting to focus on how we're working in parallel. I mean, community planning is at the heart of what the IJB does. That was all.
Yeah, so again, maybe it's a case of, as Luann says, the language that we use in the reports and making reference to those wider activities if it's relevant.
Yeah.
Yeah.
Yeah, there may be
Yeah,
other
absolutely.
There may be other places, but I mean, I would find it very, very helpful to know where we're monitoring the LOIP. So that's just a thought. Luann.
Yeah, Martin, I think it's a really valid point to be raising our connection with the LOIP. I think how I would frame that is it's not for us to be monitoring the LOIP, because there is all the community planning board and all the work that we're involved in that monitors the LOIP. What I would be looking for assurance in this committee is that we're playing our part as a key stakeholder in the system. So report could come here just to identify you know, the number of areas that the partnership is leading on, for example, and that type of thing, so that we're holding the partnership to account for its role in the wider delivery of the LOIP. But the governance for the LOIP sits with community planning. That would be my sense. I don't know if that's along the lines of what you were thinking, Martin.
Yes, it is. It's just to try and get that strategic overview of how everything interrelates, and how do we integrate the really important goals that we have through community planning. Yeah, just along those lines. I mean, I'm not sure how you achieve that, but it's. I mean, we also have at the end of the reports, we've got the tick list, but there's no mention of community planning in there. I mean, we take into account financial risks and so forth at the end of committee reports, but not the LOIP, which are key key policy issues for us. But I don't want to be I don't want to be adding to the burdens of people. I don't want to be creating unnecessary extra work, but just seems quite an important connection to make. Anyway, I'll leave it at that. Thanks. Okay, that's been helpful. Thank you. 4.3 was review of duties and year-end report. Everybody content with the recommendations there? Is that okay for?
Yep, happy.
Everybody's okay with 4.3. That takes us on to the strategic risk register, which I think we're becoming familiar with. And that is Martin Allen.
Yeah, thanks, Chair. I'll just briefly introduce it. So the committee has before it the updated version of the strategic risk register. The senior leadership team reviews the register and recommends an updated version to this committee for formal review twice a year, as well as an annual review to the IJB. Since the register was last submitted to this committee in November, the document has been updated and considered by the senior leadership team on a quarterly basis. The updates are undertaken with the risk owners, and we look at any movement or changes to the risk controls, mitigating actions and assurances. The revised risk register forms the appendix to the report. It is proposed to arrange and get a date for the annual workshop for all IJB members to review the strategic risks. So we'll get that onto the IJB seminar planner in due course. Happy to take any questions. Thank you.
Fine. Thank you very much. John.
Yeah, thanks, Martin. In fact, thanks, Martin and Martin. Yeah, I think it would be good if we could get a seminar, possibly sooner rather than later, because when I think about the things that keep me awake at night, it's risk 1 and risk 7 in particular. So I guess it would be good. I mean, I think the guys are doing a good job. The risk owners are doing a good job. But I just figure it would be good to get a bunch of us in a room and do some brainstorming and try and think of some outside the box solutions. So, you know, in the same way that with Morse for community nursing, we couldn't recruit folk, so we used some IT, and the IT actually gained you more people than you could have recruited, as it were. So thinking about some of that stuff, I think would be really good. I've got a specific question on or suggestion or thought just to drop into the mix on page 82 on risk 7, where we look at where it talks about gaps in assurance, and we say we need some more dedicated project support for the workforce plan. And I'm kind of thinking, if this is a very high risk issue for us and it's a kind of mission critical issue for us, are there other projects that are still important but not quite so worrisome that we could redeploy some resource from, so we can actually get full attention on this?
Thanks. In relation to the first point, I'm just wondering if it would be you know, based on what you're saying, whether it would be helpful to have a separate deeper dive on risk 1 and a separate deeper dive on risk 7, and just get the risk owners, the members of the committee, IGB members, and key kind of stakeholders around to do that, and then that would help form the kind of annual review of the other risks as well. So maybe pause there first of all.
Yeah, no, that sounds like I mean, they're all important, but 1 and 7 are the ones, as I say, that give me the heebie-jeebies. So a deeper dive on those 2 specifically, I think, would be good.
Okay, and then happy that would then feed into the annual review undertaken by, for all the risks. Okay, and then in relation to your query on risk 7, I think it's worth saying that there are governance processes in place, so they have set up a delivery group to look at the workforce plan, and my understanding is within that delivery group there will be specific actions that will be developed in that delivery group. Those actions I would be planning to then highlight and document in the strategic risk register moving forward, so that members will be able to see specific actions, how those mitigating actions will help to hopefully de-escalate the risk. Sandy Reid's here, who's the risk owner. I don't know if you want to come in at that point, Sandy.
Chair, do you want me to jump ahead of June?
Yes, please.
Okay. Yeah, thank you. A couple of things there. I think I do quite like the idea of a dedicated just for kind of risk X and just separate another day for risk Y. Because I do think, if I'm thinking out loud, it can at times be easy to think we can't do this, we can't do that, we've thought of everything. And then if you bring a lot of people with kind of energy and interest, as John's kind of suggested in the room, you get a healthy sort of, well, why are we not doing that then? Or why have we not tried that then? Or we used to do that in Leeds, or we did that in Murray or whatever. That can actually create quite a lot of energy. And it also probably would be interesting, I'm guessing from a kind of governance point of view, that some of the things that I'm maybe thinking, or we're maybe thinking we can't do, and people in that committee might say, actually, you can do that if you kind of provide this information or you provide this mitigation. So I suppose I'm volunteering, I'm agreeing with the suggestion. And if you wanted, Martin, the workforce one to be the first one, I don't mind. If you want the other one to be the first one, I don't mind either. But I'd be happy, because I think healthy challenge and healthy kind of discussion is a good thing, John. So I quite like that idea. And Alison's had to leave for an appointment, but I think it would. I don't think I'm misquoting her. We had a kind of chat yesterday between me, Martin, and Alison, and I think she is looking at identifying not necessarily permanent alignment, but some short-term alignment from her relatively limited resources to support project aspects, such as maybe action planning. And that, I think that's a reasonable reflection, is it, Martin? I'm not describing Alison in her absence.
I think that's fair, and also, coupled together with the governance arrangements already in place, as I said, about recording those mitigating actions, specific actions in the risk register moving forward in relation to that risk and other risks.
Okay, that sounds good. June, you want to come in there?
Yeah, thanks. And Martin, recognising the wickedness of the issues that are described within the risk register, I suppose I'm just recognising that every single one of them, there's no change to the risk profile and no update to that. So it's making me just ask the question round about the mitigating actions. Are they the correct ones? Are there other things you should be doing to try and reduce that level of risk or manage it in a different way? So welcome the opportunity for the workshops, really. And it might be, I don't know if it's worthwhile having a look back at, has that risk profile changed over a period of time for each of those individual risks, just as a level of assurance that some of the mitigating actions are working or not working?
Yeah, thanks, June. I think I'm aware that I missed the IJB last week, but I think similar questions were asked there. So I think what we're planning to do in the next review is there's a comments box at the bottom of each section of the risk register. I think it's a good opportunity to then explain to members what has changed and what hasn't changed. But I quite like the idea of that review of risks in the previous year as well, and maybe that's something that could be woven into the seminar.
Okay, thank you. Luann?
Yeah, thank you. And yeah, similar comments. When I first read this, I was thinking, do we need an extra escalation when risks are very high and they remain very high, over a long period of time? So I think that the deep dive approach is very good. And for me, the key bit there would be to think about who's in the room for that. So not just IJB members, but actually, if we're thinking of workforce, do we want to have NES there? Do we want to have NESCOL? Like, who are the partners that we can influence to help get the change that we're needing? But to really think about what would help us unlock different solutions. And the other thing that we maybe need to think about is, if we frame a risk as very high and we have these mitigating actions, there's an assumption that we can therefore reduce the risk. But actually, we might need to think about what risks we have that are enduring risks that we can manage and mitigate through actions, but that our expectations are that they may not be possible for us to reduce them to moderate risks, finance, for example, like that's going to be a high risk for us indefinitely, I think. So I suppose it's just having a bit of space to think about how we're framing these, because none of this is about people not doing things, and as well as they could be. This is about wicked issues that are complex and, are challenging across Scotland. So that's kind of my points on that. I did have a few comments on the provider sustainability one, which well, I can do that now, but I guess if we're having a deep dive, it might be covered. But here's my thoughts. I wondered if we needed to have, when the consequence bit of the in risk one is there's nothing that says about harms to people. And for me, the harms around the provider sustainability, especially when we're thinking about general practice, is that we risk widening our inequalities where we have general practice that's harder to access because people who are financially in difficult situations, the travel to get somewhere is just going to mean that they're not going to attend. So I think there's a risk, a consequence of that is a risk of widening inequalities and harm to people in our communities. And I think we just need to make that really upfront in our risks. And I thought, when I started thinking about that, there were mitigating actions. I wonder if we need to be more explicit about the partnerships, the importance of the partnership influencing local travel strategies. So for Aberdeen's travel plan, because access to health absolutely depends on bus routes and travel being available for people. So I wondered if there could be another mitigating action about how we're getting involved in influencing travel plans for the city. And I have a number of other smaller comments, but I think we can cover them. I can email Martin the details of them, or we can cover them when we have our seminar. So thank you.
Thanks very much, Luann. I think that it's clear that in 1 in 7 that for me it appears that teamwork is very much at the heart of a lot of these risks, and if we could build up relations, whether it's through commissioning with partners and so forth, there may be ways of mitigating some of the risks by developing the engagement, including FE, HE partners, travel, public transport and so forth. So that idea of the deep dive, the special meeting, I think we're very much in support of that. Anything else on the risk register? Anybody wants to raise on the risk register? I think that's the core of it that we're addressing there. Okay. That's great. Thanks very much. Let's move on then to the next item, which is the internal audit reports. 6.1.
Thank you, Chair. Public sector internal audit standards require that internal audit produce an annual report on the adequacy and the effectiveness of the board's framework of governance, risk management and control. This report is designed to meet 3 objectives: to present to this committee and through it the IJB a narrative over the key strategic and thematic findings across the year, an account of the assurance activities and resources of internal audit during the period, and then most importantly, a formal opinion on the adequacy and effectiveness of the board's arrangements for governance, risk management and internal control. For those unfamiliar with the audit opinions, these typically fall into 2 categories. So they can either be reasonable, where the board does operate an effective framework of control, or limited, where the board does not. The report covers the period from the 1st of April to the 31st of March 2023, and any work finalised during the assurance period. It also takes into account the work undertaken up to the date of the issue of the report, and the report is grounded in the whole activity of the work of internal audit, so whether in terms of formal audit evidence, management assurance, consultancy activity, or evidence gathered through our wider engagement across the council and the board. I think you'll see from this committee today, from previous committees, it's evident the board has faced another year of challenges, primarily as it continues to adapt to the post-pandemic period and calls on services as a result of other external factors. During the year, internal audit completed 4 reviews across the IJB and the health and social care partnership services delivered by the council. For these reviews, management has agreed to implement a time-bound action plan for recommendations, as well as continuing progress to actions with previous reviews. Over the next year, support will continue to come from internal audit, who will work with management on the closure of agreed actions, with their wider programme of improvement work, and also as we complete our scheduled reviews for 23-24. As such, taking all of that into consideration, I'm of the opinion that the board had an adequate and effective framework of governance, risk management control, covering the period 1st of April to the 31st of March 2023, and I can provide reasonable assurance and an unqualified opinion overall. I present my report to the committee today, and I'm happy to take any questions.
Okay, that's great. Many thanks, Jamie, for that presentation and for the report. It's good to see that very positive conclusion. So thanks for all the work, all the effort that's gone into producing that internal audit report. Anyone got any questions on this report? Luann.
Thanks, Martin. Thank you, Jamie. I think you clarified. So language is important for me, and we're an ambitious IJB. We want to be excellent. So when I read adequate, I kind of think, is that really is that okay? But actually, you're describing that's what you're looking for when you get an internal audit opinion. So there's nothing, we can't strive for excellence in this area. Is that right?
Thank you. Yeah, no, it is. Auditors aren't allowed to be too optimistic, so it's either reasonable or qualified. So reasonable and adequate is definitely the space to be in.
Okay, yay. Two questions. One, in page 95, it talks about IJB data sharing and that there may be scope for harmonisation of procedures with the two other local IJBs. I just wanted to hear if we are actively pursuing that at the moment. Is that an active line of work that's going on? Don't know if somebody in the team are able to answer. And my second question, again, probably more for the team, is that there's 4 major recommendations that are still, being worked on. Just looking for assurance that there is somebody that's got that risk, that's holding that risk, and a clear action plan for taking that forward. So thank you.
Chair, in relation to the first question, yeah, so that was one of the recommendations in the data sharing audit. So I have raised that with Alan Bell, who at NHS Grampian. So it is on our radar, but I can follow up that with Alan just to see how we're getting on, and I can send a message around the committee if that's helpful.
That'd be good. Jamie?
Thank you. Just on the back of that as well, it was a request from this committee previously that a joint report be presented from NHS Grampian, Aberdeen City Council and the IJB on data sharing. Aberdeen City and Aberdeen City and the IJB, we've completed our reviews. NHS Grampian's review is going to their next audit committee. Following that, a joint report will be presented to all 3. So hopefully on the back of that, there'll be some recommendations that can support management.
That's great. Thank you. That's all really reassuring. Any other questions or comments? Okay, many thanks.
Sorry, Martin, it was just about my second question was about the actions that are still the 4 major recommendations that we've had from our audits, just to get assurance that someone has got them as risks and is action and taking action on them to close them off.
Yeah, Chair, I can confirm that specific members of the senior leadership team will have those actions, and we'll be working with Jamie's team to close those recommendations off.
Okay.
Great, thank you.
Great. Okay, thanks. Thanks for that. Thank you, Jamie, and your team for that report and work. We've dealt with 7.1 already. So the final item is the date of the next meeting, which is the 19th of September at 10 AM. So thank you everyone for your attendance and for your input today. It's very much appreciated, and I will see you on the 19th of September. Thank you very much.
Thank you, Martin.
Thanks.
Thanks, everyone.
Cheerio.
Thanks.